If you have or suspect you may have a health problem, or if you require answers to specific healthcare questions or concerns, you should consult your physician or healthcare provider and not depend solely on information presented in this program.
And hello, and welcome back to Ask the Doctor. It's great to be with you tonight, and this is the premiere of our 17th season. As you know, this program was created to assist you in understanding medical issues so you can take charge of your own health. It's more important than ever to become an informed patient, and we're here to bring you timely health discussions. Now, for those who are new to the show, there are two ways to get in. First, you can call our live phone line at 718-499-6101. And second, you can email your questions to askthedoctor@netny.net, and we'll bring them into discussion. Now, for this episode, we have two of our favorite doctors, Dr. Marguerite Kotziner. She's a geriatric and internal medicine attending at the New York Methodist Hospital, and Dr. Bruce Garner, Chief of Rheumatology at the Lutheran Medical Centers. Welcome to both of you, and we'll meet you again in a little while. Now, for this season, we have a few things in store for you. Didn't think there's a lot of creativity in the studio now. First, I'd like to introduce you to my new on-air assistant, Kirsten Elizabeth. Let's give her a big round of applause.
Thank you very much. Glad to be here.
Look at that. You see, our ratings are already sky high now. And she's going to help answer our phones and emails. And you'll be seeing her out in the field if she doesn't do a good job. No, if she does a good job, you'll see her in the field. She's going to be interviewing people. She's going to interview you, and we're going to bring that back to a show, asking questions on the street. So, Kirsten, it's great to have you here. And no stranger to the TV, film, anything, but tell us a little bit about yourself.
True. Well, I'm really glad to be here. I am very pro health and fitness, so this show is right up my alley. And I'm from Kentucky, Anna, the border of Kentucky and Indiana. And I've lived in New York for 8 years. I live in Astoria, Queens.
Where's the part that I wrote, "It's great to be with Dr. Garner"? You didn't put that in. You left it out.
And it is so great to be here with Dr. Garner today.
Thank you. In Kentucky, they make the baseball bats?
They make baseball bats. They also make some fine bourbon.
And the four-legged animals?
You know, they have a couple of four-legged. You're talking about dogs, right?
No, I was looking for the
horses.
Yeah,
I know.
Yeah. Did they have the dog tracks too?
I wouldn't know about that.
Yeah.
Louisville.
Yeah, well, we'll try and keep the elevated level of the show. But thanks, it's great to have you here.
Thank you.
And before I get to the news, let me remind you to the number to call. Now, I see our busy lines are already almost busy. We have the number to call is 718-499-6101, where tonight's topics are internal medicine, geriatric medicine, and rheumatology. Now, email the questions. We like that too at askthedoctor@netny.net. Now, what's in the news this week? So I scoured, we had a whole summer and so on. Mosquitoes are back, with West Nile virus, right? And it could be very serious for some people, but the good thing is for most people, not that serious. And the others may have mild flu-like symptoms. But there are mosquitoes out there. You take a little roll-on deodorant, you carry it with you, and as soon as the kid gets bitten, you roll that right over the mosquito bite, and believe it or not, the itching goes away because the kid doesn't feel like scratching. It's a good thing to do. Also, you want to remember never to put the insect repellent on the kid's fingers because next it's going to go in his eyes. Now, a lot of people are into the bug zapper. They just like hearing the noise while they're eating, and so zip, zip, zip. That actually attracts mosquitoes from the other yards. So you don't want to use the bug zapper at this time of year. Of course, you don't go out indoors and so on, and you get rid of water that is everywhere. But I think the key takeaway, what I would do is have the roll-on deodorant, and then instead of scratching, teach your kid to slap it. And that slapping makes the itching go away. So you never know what you're going to learn, right? You like that, Kirsten?
I do, and I also hate mosquitoes, so.
Yeah, does anybody like mosquitoes? I don't think, no. Okay. Now, fat does not mean unfit. You've seen these big sumo wrestlers? They're actually very fit, their cholesterol is good, their blood pressure is good, but they're fat. The fat actually, there's a certain fat, the kind in your hip that's actually good for you, that has good enzymes to help break down products in the body and keep your cholesterol low. So the next time you see a fat person, doesn't mean that the person is not in good shape. And it's interesting, some people may be programmed to be looking fat, but they're actually in good shape. So, Dr. Kotziner, what do you think of that?
I think it probably makes sense. And it also depends on where the fat is deposited. The most dangerous fat is the one that deposited in the middle of the body. And this is a kind of a fat that predisposes to all these different medical conditions.
Yeah.
Heart attacks, strokes, diabetes. et
So I
cetera.
thought that was interesting, yeah. Now the next one is for Kirsten, I got this one. The shape of your alcohol glass, when you drink beer, if it's curved, you tend to drink it twice as fast than if the glass has no curve in it. I thought that was interesting. And actually bartenders know that and try to get you the beer in a curved glass. And interestingly, it doesn't have the same difference for soda. If you put soda in a curved glass, you drink at the same rate. So it's something to think about. If you're at the bar and so on and you want to make it last, get a flat glass as opposed to the curved glass. Kirsten, you just missed something for you. Do you like beer or you don't drink much?
I do occasionally enjoy some beer.
Now, if you drink it out of a curved glass, you drink it twice as fast as if you drink it out of a flat glass.
Is that so?
So this is why they try and push that on you, the curved glass. So the next time you're in there, just say, you want the flat glass.
I never knew that.
You came to the show, now you know. Yeah, so, okay. Now, the other thing is a little scary. I don't know, did anybody, Bruce, did you lie down with the kid in bed? When they went to sleep at night, did you let them sleep with you?
Well, they would come in. My younger son would wander in the middle of the night, but we cured him of that by the time he was 17.
Okay.
But he would come in and sleep with us at night, sure.
Well, a major study came out of actually the Philippines. If you sleep with your kid, you diminish your testosterone level 50%. It's not good. It brings out the caring side of men. Usually the high testosterone makes them a little aggressive.
Right.
This makes them then care more, become more female-like, the trait of being able to take care of the kid. So I don't know what the message is here, but it's probably not a good idea to have the kid sleep in bed with you because of, possible SIDS and so on down the serious side. But also it's probably not a good idea if you want to keep your testosterone level to sleep too much in bed. So I hope that was useful for everyone. You learned mosquitoes, testosterone, everything, right?
Nothing wrong with a sensitive man, though.
You like a sensitive man.
You gotta like a sensitive man.
Yeah, well, my brother's sensitive.
I never knew why until now.
But anyway, and you just got married. I want to talk about that later.
Perfect.
I understand you just got married. But
Actually, right now, I could talk about the quiz today.
whoa, okay, we're ready. Let's hear
Yes,
about
we're
it.
ready to talk about the quiz. So, I am so excited because my favorite season, fall, is approaching very quickly. And one of my favorite things about fall, besides pumpkin ice cream, are the beautiful full moons. So, the first quiz question today is, what is a blue moon? You've heard the expression once in a blue moon. So what is it? What's a blue moon?
Yeah.
The second question, Pope Benedict XVI is set to visit Lebanon on September 14th, which the Net TV is covering. So definitely tune in for that footage on the 14th. And the question is, which Eastern Catholic Church is Lebanon the center of?
Is that cool the way we got a commercial in the quiz? I like that. Yeah, very good, Chris. Not here
Thank
for that
you.
long. You knew it. Excellent.
Thank you very much.
So anyway, this blue moon thing, I'm curious to what that answer is. You know the answer to that one.
I do.
Excellent. So we should be interesting. We're going to take a short break, but I can't believe it. Today's the 11th anniversary of September 11th. I'd like to take a moment to silence, to commemorate, to memorialize this. And I guess everybody has remembrance of where he or she was on that day. There are certain events in life that you never forget. And I just remember being in St. Vincent's, which was the closest hospital to the World Trade Center, at what seemed like an important budget meeting, which paled after seeing what happened. And all of a sudden we heard a droning noise, and I said, what is that? And somebody said, sounds like a plane. And the next thing we know, we heard an explosion and screams. We had no idea. And we ran out on the street and watched and couldn't believe that one of the World Trade Centers, we figured a small plane went into it. And then as we're watching, a burst of flame encompasses the other tower. And you know that something was up, that this is not just an accident. And we went into the mode of rescue, where we have all the doctors to the street, the personnel pools, things of blood. People started coming for blood. And in the first 30 minutes, 300 patients arrived. And we figured it's going to be busy. For the next 5 hours, no patients came in. And we knew that the reason they didn't come in is because they were killed. There weren't going to be any survivors. And the hospital was devastated. I just remember Cardinal Egan sitting on the steps there. I never, so dejected and so depressed. What a depressing event it was, and how it goes on. If you watch today on TV, the people with these very tearful comments about their family, it's very hard to even watch. So maybe as we talk, some of you have remembrances, because this is something that can never be forgotten, this barbaric event that occurred. So Well, let's take a break, and we'll come back, and we'll get on with the business.
Hey, God bless. David Basson, the Two Blessed Guy from Net TV. And guess what? In September, season number 5 of Too Blessed to Be Stressed. That's right. Get ready for new blessings and new guests. It's going to be a year full of blessings for you and your family. So keep your eye on Net TV. Peace.
And welcome back. It's nice to see the Brooklyn Veterinary Group. You got to mention them, you get a discount there. It's a pretty good deal. Thanks. I always wondered why the veterinarians are sponsoring this show, but I don't know if that says anything about the medical advice. Anyway, I'd like to acknowledge Monsignor Bennett, who's out there, sitting right there, actually. Monsignor Bennett has kept this show going on for many years. He's a big supporter of the show. He's only missed one episode all these times, so we always like to say hi, Monsignor. Any loyal viewers want a shout out?
As a matter of fact, Dr. Garner, yes, we would like to give a shout out to Mary O'Hare. What's up, Mary? Thank you so much for being such a great viewer. We appreciate it. Keep watching. Thanks. And also, Dr. Garner, something fun. On line 4, Patricia thinks she knows the answer to the trivia question.
Well, hold your tickets, because we see this all the time, like bingo, right? You always hate the guy in bingo, yells bingo, and then he doesn't have 068, right?
All right, all right.
Okay. Hi, Patricia.
Yes, good evening, Doctor.
Where are you calling us from?
I'm calling from Sheepshead Bay.
Oh, not far from here. How are the boats out there?
Oh, fine, wonderful,
What is that
wonderful.
restaurant right on
wasn't
the-
too good
on the
though
dock?
when we had the. Excuse me?
What's that restaurant on the dock? Fonino or something? Or what is it? Fonetto?
Oh yes, yes. You'll have to excuse me right now. I'm so nervous. I can't believe this is happening.
I know,
I
this
can't
is,
believe it. I go to Methodist. My heart doctor is Dr. Saki.
Okay. Is your heart palpitating now?
You had him on the program last year.
I know,
He
Dr.
was
Saki. Could you just talk up a little bit? Talk into
Yes.
that phone.
on. Okay.
A little bit more?
Can you hear me?
I can hear you now. And what do you,
Okay, very good.
so what do you think? You think you know the answer to the quiz?
I hope so.
No, which quiz? Is it the quiz about the Pope's quiz?
About the blue moon?
Blue moon.
Why does it happen?
Okay, what is a blue moon?
I think it happens when there's 2 full moons in the month.
Whoa, could that be? Well, again, hold your tickets. I'm going to ask Teresia, is that the answer? Is that the correct answer? Whoa, did you hear that?
It
Hello,
is.
Patricia?
Yes, yes.
You're winner. Grand prize winner.
Oh, this is wonderful. We just had a blue moon not too long ago.
Yeah, it was beautiful, right?
Right, and that's why I knew the answer. I can't believe this. I can't believe that.
No, tell me, do you have a place set for this plaque?
Yes, I'm going to have it right in the living room where everybody usually sits and watch TV
Beautiful.
and watch your program. Absolutely, and we learn about medical.
Oh, that's great. And Kirsten, you haven't seen this plaque. Handmade plaque, beautifully in Japan, so it's imported, and it's magnificent engraving.
Oh, wonderful.
And Patricia, make sure to email us at askthedoctor@netny.net with all of your information so you can get that beautiful plaque, okay?
Oh, thank you, Kristen. Thank you so much, and good luck on the program. You're beautiful.
Oh, thank you.
God bless you.
Thank you
Yes.
Thanks a lot.
Yes.
Thanks, Patricia.
Thank you, Dr. Gardner. God bless you and all your co-workers.
Thanks a lot, and congratulations.
Thank you
There's
so
only
much.
25 of those now out. 25 plaques in the history. That's it.
Wow.
Excellent. Okay.
Unbelievable. And
Thanks,
I'm
Patricia.
one of them. God bless
This is
you.
the gracious winners that we like. You know, makes people
She's
happy.
really nice.
Now I'm going to let's start interviewing our doctors here and see what we have. Dr. Katsina, it's great to see you.
Likewise, I'm really great to be back.
How was your summer?
Summer is very good and it's relatively light and so far.
Now let me
everything
ask you a
is good.
question.
Yes.
The boardwalk. Do you know that the boardwalk in Coney Island, Brighton Beach is wood because it's a boardwalk. Now, some great minds have come up with the idea of making concrete boardwalks, so it's a sidewalk instead. What do you think of that? I know you love the boardwalk.
You know, I love the boardwalk, but I think it's just the wooden boardwalk gives you the different feeling when you walk on it. But unfortunately, there are certain things that beyond our control.
So you like it? You think it's the site? You're giving some? You think the
I'm
cement?
giving
may
an
be good?
okay to the wooden boardwalk.
To the wooden board, where I agree. Yeah, yeah. Did you ever go on any of the rides there in Coney Island? Like any of the big cyclone or anything?
Just many, many years ago, but so far I'm not really in favor of all of this at the
We
moment.
go on the cyclone. Yeah, cyclone. Great. You ever been on the cyclone, Kirsten?
I've been on that giant.
The Wonder Wheel?
The Wonder Wheel.
Yeah, that was from the World's Fair, I think. If I'm not mistaken.
It's amazing.
1939. Yeah, it's beautiful. You go on the swinging car?
And terrifying, yeah.
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 I know. I love Coney. Coney Island's a great place. So, and tell us, what in medicine excited you? Any advances recently?
So one of the one of the newest facts, in fact, is something that you mentioned about the people who appear to be obese may in fact be fit, as long as they have high blood pressure and high cholesterol and have no diabetes. So this is definitely something that has been in the news. I do specialize in geriatrics, so that's why the Alzheimer's disease is definitely something of great interest to me. Particularly, it's so common. So statistically, is about 5 million people are suffering from Alzheimer's disease, and unfortunately, so far we don't really have any cure. So if there is a lot of research, a lot of new medications, and have been going on, and unfortunately, so far we don't really have good medication. What is interesting is that that in fact, when we do see the changes in people who we diagnose with the Alzheimer's disease, the process has begun about 20 years ago. And a lot of times, so it's a time, right? So 20 years ago, the process started. And ideally, if we're able to identify the time, we'll be able to maybe reverse the disease or change the course of the disease. So there are a lot of new developments into this area, but so far it's all in progress.
Thank you. We're going to be taking a lot of questions, geriatrics, any general medicine questions. Dr. Garner, what do you think of our new set?
I love the new set. I think it's wonderful. I love Kirsten. Kirsten?
Well, you say tomato, I say tomato.
Yeah. But the new set, I know quite frequently when I've been on the program in the past and I say to people the next day, what did you think? They mention the set mostly. They say the set was very nice.
And what was the highlight of your summer?
Other than tonight, the highlight of my summer was having both of my sons home with us. My oldest son is at college now, as you know, and having the family together. Our youngest son's going to college next year, so my wife and I are already getting weepy about being empty nesters next year.
Empty nest. I think Dr. Katsina has the empty nest.
Yeah, I used to have empty nest, but now my daughter is back with us. So it's not an empty nest anymore.
Right. So anyway, we'd love to hear as many calls as you're going to get. I don't know, Kristen, I see is busy. I know she didn't expect this. She would ask for more money here. What is this? She says. What do you got?
All right, so line one, we have Judy from Forest Hills.
Oh, Judy. Hey, Judy. Judy. Judy.
We had Judy once. So.
Hello.
Oh.
Hi, Judy. How are you? You may be listening to the TV. Why don't you turn it down? Thank you.
If I can just turn it down?
Yeah, just turn it down. We're going to wait, okay?
Okay, I turned it.
What are you watching?
I'm watching
Sometimes they're not watching our show, and that's the thing. What? Judy, just turn off if it's not ours, okay?
Okay.
Okay, thank you.
All right, I turned the TV off.
Okay, we're ready. Do you have first of all, welcome.
No, I don't know the answer. Okay. I'm calling with the medical question, actually for a friend of mine. Hello?
Yes, I'm listening. We always hear this friend of mine stuff. Okay.
No, anyway, she has extreme fatigue that hit rather suddenly.
Oh.
She had phlebitis, which was treated with an antibiotic, and then about 3 weeks later, she got this extreme fatigue. And then her eyes started to droop, one eye, the lower lid, and each day she seems to be getting weaker and weaker.
How old is she?
83. But she was she was in good shape before the phlebitis. There was nothing really wrong with her.
Okay, Judy, I get an idea, and you're gonna get two different answers, one from the rheumatologist, one from the internist. We'll start with the female internist first. What do you think about this almost chronic fatigue that this 83-year-old woman has?
It's rather acute, I would say, subacute. And, there is definitely, the story is very concerning, particularly once you mentioned the phlebitis. So the concern with the recent phlebitis and worsening fatigue day by day is spreading infection. It is also possible that the phlebitis was caused by the bacteria, and bacteria have spread in the bloodstream. And in fact, the patient having your friend may have bacteria in the blood. So that is why it's extremely important, if it's actually of paramount importance for your friend, to see the doctor as soon as possible. And the doctor has to test the blood and make sure that there is no infection. There is also some other possibilities. Maybe there is a kidney problems, maybe there is a liver problems. Your friend might have been taking the antibiotics, so that the doctor will have to take
No, she never took an antibiotic before.
But Mary, I mean, Judy,
My concern would be, had I seen the patient like that in my office, my concern would be to make sure that there is no infection in the blood, and to just see the doctor and have the blood work done as soon as possible.
Okay,
thank
thank
you.
you.
Wait, we got to get one more part. What would you see,
A number of possibilities, and certainly we don't want to be alarmist. Sometimes, and while it's unlikely, we hope in your friend, a phlebitis is seen beginning with, God forbid, a malignancy. And the eye
But the
droop
phlebitis is cleared up.
I'm sorry, what?
It's all cleared up, the phlebitis.
It's all the phlebitis
It's
cleared
Cleared
up.
up, but now she has the eye problem.
Yes.
We sometimes see something called Eaton-Lambert syndrome, which can do that. We also have to worry because of her fatigue and the eye problem. Sometimes hypothyroidism can occur on account of an underactive thyroid, and that could be as a result of the primary problem which she had, the infection when she was in the hospital, was a stress in her system. So I think that, as Dr. Kotsina said, the important thing is you get her to her primary care physician, who starts to do a more extensive workup.
So Judy, definitely we think something's going on here. There are certain symptoms that may be manifestation of something more serious going on in the body. We need to get to the bottom of it. All right, Judy?
Yes, thank you so much.
Good to talk to you. Hi, Kristen. How you doing there?
Good. You know, we got a real firecracker on line 2. It's Joe.
Joe Stiles?
It's Joe.
Joe's upset because I say see you in the tablet. Let me see what Joe has to say today. Joe.
I'm here.
Joe, how you doing?
All right.
What do you think? What do you think of that? See you in the tablet?
Huh?
You like that? See you in the tablet?
Oh yes, I read your tablet every weekend. I have your program, and not only that, Dr. Garner makes a great image on his program for what he does, and he's a great leader. And we need more people like him on the air.
Joe, I think it's a good place to quit right here.
60 years in a hospital circus, I can say that.
Joe, thanks so much. And really, Joe Style, just for anyone who doesn't know Joe Style, which I can't believe, he's at least in his 90s, sits on major boards of hospitals, recognized. They're actually doing a film about his life, which would be, maybe we'll show it on here when it comes out.
Okay, who am I talking to?
That's the thing, Joe.
Huh?
Okay, have a good day. Take care. Okay.
All right, we have a lot
Kirsten.
more calls. We have Ivan on line 3.
Ivan.
And he's from Midwood, Brooklyn.
You know what's interesting? It doesn't translate here from line 3 to there. We're not quite synced over here. So Ivan, call back because we don't seem to have you on here right now. But
Okay.
How are the people? Are they friendly to you, Kirsten?
They are. They are. I mean, like I said, Joe's a firecracker.
Joe's great. I wish
He's
you.
good. Good
Yeah.
to meet him today. Line 4,
Yeah.
Sally from Forest Hills, Queens.
Well, a lot of calls from Forest Hills today
Yeah,
already.
definitely.
Hi, Sally.
Yeah, hi.
How are you, Sally? I want all our callers to talk up today because I think we're saving electricity here.
Okay. I want to know how the rheumatologist would treat RSD, reflex sympathetic dystrophy.
Oh, very good.
Well, that's an excellent question. That's often a diagnosis which is missed by people. Reflex sympathetic dystrophy usually occurs when someone has an injury in one part of his or her body, such as the shoulder or the hip, or someone's at rest for a long time. And paradoxically, while the person may have hurt his shoulder, that's not the area that's affected by reflex sympathetic dystrophy. It's an area which is further away, quite often the hand or the foot.
Right, my hand is very swollen and it's paralyzed. I can't do anything. I can't function.
Well,
would you
it
treat
begins with severe pain. And if you catch it early, the best treatment is anti-inflammatory medications. Sometimes we give steroids, cortisone-type medications, and intensive physical therapy. If we don't give that intensive physical therapy and the anti-inflammatories and the pain medication, there's a danger of this becoming chronic, where, God forbid, you can have tingling and numbness and burning, and you can actually have contractions of the hand where you're unable to use it. How long ago did they diagnose it in you?
Probably a year ago, and my hand is like a lobster claw, and I can't function. I don't know what to do. I can't take steroids. I'm a diabetic, and I can't take anti-inflammatories for a stomach condition, and I can't take painkillers because of constipation. They want to give me gabapentin.
I think gabapentin is a very good pain medication for something like this. It will help you complete more physical therapy, and hopefully you'll regain some use of the hand and decrease the pain.
I'm very depressed. I can't function at all. I'm lying on the couch.
I'm sorry to hear that. Also, another thing which might be useful before we go to break, another thing which might be useful is visiting a pain specialist.
Yeah.
Sally, it's good to hear from you, and we're going to have to go to a break. Before we do, I want you to think, Dr. Katsina, about patients that you have that have hypothyroidism. Their thyroid is a little low. How it's different, how it presents in the elder population.
Oftentimes, it doesn't. Patients may not have any symptoms, or symptoms that they complain of are very nonspecific, such as fatigue, depression, loss of interest. And in fact, one of the blood work that we do in people who presents with symptoms of Alzheimer's would be we check for the thyroid, because it does happen rarely though, but low thyroid function can give the patient symptoms of forgetfulness, some memory problems, some low functioning.
Thank you. Thanks a lot. So I wanted to remind people of the quiz, actually, and Kirsten, remind them of that quiz, the second one.
Yes, absolutely. So they already answered the blue moon. So the second quiz is, which Eastern Catholic Church is Lebanon the center of?
Tough one. That's not an easy question.
That's really hard.
Anybody been to Lebanon in here? Oh, okay. It's not on my list of going. I mean, I like Lebanon. That's no problem. But I just anyway, we're going to go to. Let's take a little break, okay? I think she's been working hard, Kirsten. You know, let's give a break so we don't burn out here. All right. So when we come back, we're going to be talking about geriatric medicine, rheumatology, and internal medicine. Right. Now, remember, 2 ways to get your questions in. Email us at askthedoctor@nettny.net. Or call us at 718-499-6101. Okay? We're looking forward to hearing from you right after the break.
Hey, God bless. They've been showing the two blessed guy from Net TV. And guess what? In September, season number 5 of Too Blessed to Be Stressed. That's right. Get ready for new blessings and new guests. It's going to be a year full of blessings for you and your family. So keep your eye on Net TV. Peace.
And welcome back to Ask the Doctor. I see that Brooklyn Veterinary Group is still sponsoring the show. It's just tremendous. 20% discount. Welcome back, Dr. Katsina, Dr. Garner, and Kirsten. And our topics are internal medicine, geriatric medicine, rheumatology. We have Dr. Marguerite Katsina and Dr. Bruce Garner, and we're going to speed this up a little bit now, so a little bit in overdrive. We have anybody, Kirsten?
So on line 1, we have Anne from Brooklyn.
Okay, thanks for calling in. Who's next? No, okay. I don't want to speed it up that much. No, we'll take it easy. And hey, how you doing, Ann?
Hi, Dr. Garner. This is Ann from Brooklyn.
Where are you calling? Which part?
From Bath Beach.
Bath Beach. Is that Spumoni Gardens out there?
There's Spumoni Gardens, there's Tomaso's, there's New Corners, there's quite a few nice places.
How about the Vegas Diner?
Vegas Diner, I'm there almost every day for lunch.
Yeah, that's a great diner.
It is a great diner.
So what can we do for you tonight?
Well, I have to ask you, I had an operation about 3 years ago on my eyes, cataract operation on my eyes, and it left a halo around my eyes, and they said that's pretty common.
You know what it is? I don't have the ophthalmologist on this show.
Oh.
But no, it's not uncommon. It's not uncommon. But did your doctor talk about lasering?
Well, no, because now what's happening is now the sun is bothering my eyes. I really can't even go into the sun because it's very, very bright to me, the sun. So I always have to have dark glasses on.
Oh. Well, so, if you email me, I'm going to get you the answer to your question, okay?
Okay.
Okay, take care. Kirsten, who else is in store?
Line number 2, we have Michael from Bensonhurst, Brooklyn.
These are all new people, actually. I haven't heard from them in the past. Hi, Michael.
Hiya.
Good. Have you called the show before?
Of course.
Okay. I don't hear. Talk a little bit more.
Last year, yes.
Oh, now I hear it. Okay. I remember that the last year.
Yeah, last year we were trying to, we almost had the answer for that.
Yeah. Which one was it?
Oh, something with the baseball, football,
Yeah.
one of those things.
Anyway, how are things out there in
Everything
Bensonhurst?
is good. Everything is good. We just finished up with the feast.
Oh, my daughters wanted to go to the 18th Avenue Feast?
Yeah, you missed it. It's over.
How was it?
Oh, it's beautiful.
They've been going. Do you ever hear that feast on 18th Avenue?
Yeah.
It's for many years. At least 30 years? Anyway, Mike, what can we do for you?
Oh, I got a question on, I was wondering if anything, if you take too much of meloxicam, does that thin out your blood?
The answer is yes, it does. Meloxicam, for those who are watching and don't know, is an anti-inflammatory. It's in the same class of medications as Aleve and Advil. And all of those medications can thin out the blood, so you have to be very, very careful. And if you're prone to ulcers, you may want to take something like Prilosec or Omeprazole to help prevent an ulcer. So not even if you take too much, just the lowest dose can actually thin out the blood. And you have to be careful. Those of you who are taking that baby aspirin every day to prevent heart attacks might have an exaggerated response.
So, Mike, you had a good summer?
Yeah, very good, very good. Went to see my grandson up in Massachusetts. Yes.
I didn't even know. You don't sound old enough to be a grandfather.
Yeah, no, I'm a grandfather. He's 15 months. Wonderful. I was telling you, remember my son-in-law is the surgeon, spine surgeon at UMass.
Yes.
Yes.
So you want to give a shout out to your grandson?
Yeah, hey, James, my man, where are
All
you?
right. Good man, Mike. Take care.
All right, what about that trivia question?
Do me a favor. Mike wants to answer that question about the Pope. Can you just
Great.
repeat it quickly because he doesn't know?
Yes, of course. That question is, which Eastern Catholic Church is Lebanon the center of?
Oh, okay, so slightly different from what I told you. Is it on the tip of your tongue?
No.
No,
I'm
okay.
dead.
It's a tough question. I don't know who's going to get that question.
The
Okay.
saint that's holding the behind you.
Mike, what do you think? You like the new set?
Yeah, I love the set. It's beautiful. It brings back 2012 now, and then you look like you had it in the 60s when you were. But what's the name of the saint? My wife would like to know. That's one behind you.
The saint behind us. Are you making up a quiz?
No, on the picture behind you.
That's St. Vincent.
St. Vincent?
Yes, St. Vincent, like the hospital.
Okay, thank you so much.
Take care.
And it was great talking to you, and God bless you all.
You too.
Doing a great job.
Thanks a lot. He likes the new show, Mike. Huh? He likes that St. Vincent, yeah.
He's a nice guy. So line 3, we have Ivan back.
He's gone
He's
again.
back.
That Ivan's playing cat and mouse
Are you
with us
sure?
here. On my instrument here is down.
Ivan. Okay, in that case, Lisa is patiently waiting on line 4 from Midwood, Brooklyn.
Ivan, you call us back, okay? I want to talk to you. Hi, Lisa.
Hello?
How are you, Lisa? You calling us from Midwood?
Yes, I am.
What do you consider Midwood? Because, people have different neighborhoods.
Avenue P and Ocean Parkway?
That's Midwood, I think.
Yes.
Very good. Avenue P and Ocean Parkway. You've called before.
Yeah, I did last year.
I remember that call. How are you feeling?
I'm okay. I have a little problem. My immune system is very low. And I've been, drinking juice, eat fruit, but it's still low, which, from time to time I catch a cold. I need to know how to improve it.
Okay, we're going to get 2 30-second answers. How do you improve an immune system?
So the first step is, you need to be evaluated by your doctor. Make sure that your blood work is in order. Secondly, the best preventive measures and the best things to improve your immune system, healthy diet and exercise.
I think that's reasonable.
Okay.
Dr. Garner, anything?
The only thing I would add to that is getting a good night's sleep. Sleep is one of the body's natural defense mechanisms, and most people do not get enough sleep.
Oh, in a couple of weeks, we're having a sleep specialist on, by the way. You want to tune into that show, and he's going to do a live demonstration of the machines that you can use to help it out. So where are you going to be in 2 weeks from Tuesday?
Okay. I have another question.
Okay, thank you.
Okay.
I went through a blood test. Everything is okay, more or less. But my doctor recommended
a vitamin, not vitamin, the B12 shot. Would this help my immune system?
Lisa, I'm going to let you listen to the answer, okay, because I'm afraid you're going to slip another one in, and we're going to get the answer from both. Doctor, what do you think about vitamin B12 shots?
It's only indicated if your vitamin B12 is low in the blood. Otherwise, there is no indication of a vitamin B12 to be used just to improve your immune system.
That's 100% correct.
I mean, a lot of people are out there taking vitamin B12, feeling better just because of a placebo effect they think is making it better, and it's really not. And a lot of times if you take it by mouth, you're not even getting it
Right, you don't even
absorbed.
necessarily have to get an injection. It just, pill works as well as the injection.
You know, I want to say, I'm going to get to Kirsten because we got some emails, phone calls, and so on. There is a show, a live show coming up, and I'm going to tell you more about it later on 8th Avenue and 2nd Street, the Church of the Virgin Mary. A live Ask the Doctor show to be shown on the air. You want to get on the TV, you want to meet Kirsten, you want to meet the cameraman. I don't know why, but if you did, you come down to that show, and we're going to tell you more about the story. Now, tell us a little bit what you got,
I'm
Kirsten.
really excited about that live show, by the way. It's going to be really fun. But right now, on line 3, Mary Ellis from Bay Ridge.
3, we're having trouble. Again, Ivan, everybody got off of line 3. I don't understand that.
Oh,
line
she
3.
had a quiz answer.
Call. What's her name? Mary Ellis?
Mary Ellis.
Mary Ellis, call us back.
Call
we'll
us
take...
back. All right. So Leah, on line 1, is calling from Mill Basin, Brooklyn with a question.
Beautiful neighborhood. Hi, Mill Basin. Leah?
Leah.
Hi.
Leah. Hi, Leah.
Hi, how are you?
Good, good. You sound a little nervous.
Yes, I am.
No, you calm down. What about that deli out there where they have the paintings?
Oh, yeah.
You like that place?
Yeah, it's nice.
Yeah. So what's your favorite sandwich? You go into the deli, what do you take, a rare roast beef on rye?
Well, I usually take just turkey.
The extra lean. Can you have lean turkey? I don't think so. But anyway, Lisa, what can we do for you?
Well, this question is for the rheumatologist.
He's right here. Okay, let's hear it.
I'm listening.
Well, I recently had chest pain as well as joint pain, and I had blood work done, and I've seen 2 rheumatologists, and the first said that he believes that it's a mild case of lupus. However, he can't actually diagnose me. And the second said that she believes it's gastrointestinal.
Okay, we're going to take that lupus because our phones are a little bit off. Just ask about a mild case of lupus.
I think most likely many people are diagnosed as having lupus who do not have it on the basis of a blood test, and they're told they have, quote, a mild case of lupus. The most common reason we see chest pain and joint pain, in fact, is stress and not lupus. One quick question, how old are you, Leah?
I'm 27.
It would be highly unlikely that you have lupus at the age of 47. What I suspect...
27.
27?
Yes.
It certainly is possible, but I would go for another opinion. You need 4 out of 11 criteria to make a diagnosis of lupus, and you need an experienced rheumatologist who's going to make that diagnosis for you.
So Leah, you need to check it out. From what I'm hearing is probably not, but you want to get it checked out, okay?
Okay.
Thanks, Leah. Thanks for watching.
Thank you so much.
Good to hear from you. Kirsten, any other business for us over there?
So much business over here.
What about line 3? I want to grab that before we lose it.
Oh, you want to try it out?
Yeah, who's
okay,
that?
line 3 is Dolores from Jackson Heights.
Okay, let's see if we can get Dolores.
Let's see.
Hey, Dolores.
Hi.
How are you? Beautiful voice.
Who am I speaking to?
Who did you want?
Well, one of the doctors, Dr. Gardner, someone to speak to.
You got one of them.
Oh, whom I have now?
Dr. Steve Garner.
Oh, hi. How are you?
How you doing? I like Jackson Heights. That's really a melting pot. Have you ever been? You live in Queens, Kirsten, I think.
Yes, I spoke to you once before, if I'm not mistaken.
I remember that, but Jackson Heights, that's near the train?
Well, that's going towards Zitmars. I'm more up near Zitmars and Astoria.
Oh, excuse me.
On 80,
No,
more
that's
near
a good
LaGuardia
neighborhood.
Airport.
Very good. So what can we do for you?
Well, I want to find out, talking about 2 years ago, I went to a dermatologist, and it had like right on my left arm, and he had told me they were bedbug bites, which I went crazy. I couldn't believe it.
Okay,
Well,
thanks
to
for
make a
sharing.
long story short, they gave me some kind of medication, some Sath, whatever. Then, I threw everything out. I had the whole house torn apart. I tore a lot of stuff out. But then last year, on top of my shoulder, underneath the skin, they look like a pimples.
Pimples, I
Then
know,
they
yes.
come-
I had
they come to
preparation. I know,
whitehead.
yes. But
can
listen,
you hear me?
I want to just get into this bed bug story because you don't have to throw everything out. That's one of the things, and they don't
Well,
live
I
below.
understand that, but I'm a very fanatic in my house.
But it's not. It's not the a sign of dirtiness. It's more a sign of clutter. So getting rid of them, really covering the bed with
Well,
plastic.
I only had it in one room. That was my son's room. I had them nowhere else.
Well, let me get the two
I'm
doctors to
figuring my
weigh in on the
son
bed
might pick
bugs.
them up somewhere.
I want you to listen to their answer, Dr. Katsina. Give me 15 seconds on a bed bug.
Bed bugs are very challenging to get rid of. It's first of all you have to make sure that the rash that you had was indeed due to the bed bugs. So
Yeah.
you'll have to make sure that you'll see the doctor. Secondly, to get rid of bed bugs, as I said before, are very, very challenging.
Yeah.
And
Well,
again,
I'm
it's
not
not
worried about
you may
that,
require
doctor.
a
What
lot of
I'm worried
different
about now-
Wait, but I wanna
people to get involved.
Tricky thing, these bed bugs.
But what I want
1 second,
to-
Leah. Bruce?
Well, I think that perhaps now the new rash, the pimples you were speaking of, could be due to a number of different things. But sometimes the salves that we give to treat one thing cause allergies or reactions, which could cause a new rash, and it's actually from the salve you were given to take care of the first
If
one.
you could be seeing a little bit of blood spots on the sheet, that's a good sign that you have bed bugs. So if you have those little blotches on the sheet, you got to get into that. And there are people that specialize in this, so you may want to hire somebody professionally. That's probably the best way to get rid of them, all right?
Excuse me, but I did. I'm have another question.
But no, we only have a few minutes left.
You already had your question, and we have a lot of other
But
people
anyway,
on the line.
call us back and let us know the saga next week of those bed bugs, okay? They can be a very distressing thing.
Definitely.
Before I get there, I want to talk again about that we're coming to a local parish to do a live audience show. I mean, this is like a regular show, just like you see here, and he's going to be filmed for the air in a couple of weeks. It's a chance to meet the doctors, Kirsten. Now, here's the information. On Sunday, September 23rd at noon, at Church of the Virgin Mary at 216 8th Avenue, Brooklyn, in Park Slope. That's 2nd Street and 8th Avenue. A free event, but please register.
I have
appreciate
Ivan.
that.
He's
Okay.
back.
Who's back?
Ivan. I'm talking to him right now.
Is he back on line 3?
Yes.
Okay.
Ivan?
Okay, Ivan. He's not flashing, Ivan. He's the only one not flashing.
Okay,
So
hold
I think. There we got Ivan. Ivan.
Hi, how are
From
you?
Avenue J, I think. Ivan, are you from Avenue J?
Avenue J and East 2nd.
Yeah, I ran into you once, right?
No,
Never ran into you on Avenue J?
never.
Oh, okay.
Oh, I know.
But what can we do for you?
Okay, what happened, Dr. Gardner, is I came down about 3 weeks ago with Bell's palsy. What happened is that the eye drooping, the eyelid,
Right.
it seemed like it straightened out. My mouth was all on one side, and after tonight will be 3 weeks that I came down with it, and it seems to be almost 99% better. The thing is, I was on prednisone. I couldn't take it because I have irritable bowel, and it gave me palpitations also.
Okay, so
Then what happened was I just came up yesterday with an infection in my left eye that I'm seeing a doctor. Is that normal, that infection in the corner of the left eye? Does that usually come on after the Bell's palsy is going
you
out
can
of the
imagine
system?
things getting trapped there. You touch it, You guys.
But it's not a part of the Bell's palsy. It's definitely something that has to be taken very seriously, and you have to make sure that you will not touch your eyes with your, with your hands. Use the eye drops that your ophthalmologist prescribed you,
And the cream,
please
and the
follow up
ointment.
and be certain that it's absolutely not a consequence or it's not a It's not normal after the Bell's palsy.
Ivan, give us a call next week and give us a follow-up, please.
Okay, can I ask you one more question?
Quick.
Can Bell's palsy make you fatigue?
If the cause of the Bell's palsy
Makes you fatigued?
Yeah.
I can't really. I'm just thinking of it, and I can't come up with a reason why would Bell's palsy make you fatigued. It should not.
It should not. But
No.
do I need to? You think it's a good idea to still see an eye doctor even with that little infection?
I think you have to. You must see the eye doctor because little infection can become very serious.
Okay. Thanks a lot, Ivan, and look forward to seeing you, okay? And Kirsten, how are we doing? Now, tell me a little bit of this live event that we're going to.
Okay, I've done my research.
Yes.
You have to register for this event on the 23rd at noon. It's going to be awesome. We're going to be there live. You have to register by emailing us your information. So give us your name, phone number, and that way you can RSVP for the live show. But you have to do that in order to be there.
If you're a fan of Ask the Doctor, you want to be there. September 23rd, what time?
Noon.
12 noon. Got to see you there. Now, we've been getting emails from around the world, and I see that we have an email from Zoe in Singapore.
We
do.
do.
That's a big trip.
It's
right?
pretty cool.
And she wants to know what works best for curing progeria. So we got two things. We got to what is progeria, and then is there anything you could do about it?
Okay, so progeria, it's a very rare genetic disease that affects children. And it usually becomes, the child ages prematurely. The symptoms usually appear by the end of the first year, and you notice that the child stops growing. So mentally kids are normal. What you've seen is only very small height and certain facial features. Unfortunately, the life expectancy is only about 13 years.
Yep.
So far, there is no cure for progeria.
No cure, but isn't also you get arthritis of the joints with that?
Yeah, you get premature heart disease, and apparently as people who age, and you'll see the doctor uses the medications that are used for people in heart disease, cholesterol medications, aspirin, and it's better to get treated in the specialized centers.
Okay, now we're going to go back to another email, and I think Kirsten is ready. I've been doing the reading of the emails. I'm ready to turn it over to Kirsten. What do you have?
Amazing. Well, Irina from Brooklyn writes, Dear Dr. Garner, I watch your program regularly because it's very informative. Thanks for a great job. My question, I have a 6-year-old daughter who gets a cold every single month and takes antibiotics that the doctor prescribes every time when she gets sick. I'm very concerned about using antibiotics so often. I want to consult about her condition. Would you please recommend me a really good doctor for checking my daughter's adenoids?
Oh, thank you for that question. Bruce, what do you got here?
Well, I'm not sure whether they specialize in pediatrics, but I think the best ENT physician who I know in Brooklyn is Dr. Sundaram, who's affiliated with Downstate Medical Center. And I would call his office Dr. K, first initial Sundaram, and see if they could refer you to a good ENT specialist for children.
Yeah, and I also want to mention Dr. Habib, who's been very helpful as well. So I want to thank both of them, and I hope that helps to answer your question. We're going to go now back to the phones in a second. We have one more email, actually, I think, from Colleen in Dyker Heights, and we're going to hold that off because this is a rapid sequence round, okay?
All right, so line 4, we have Patrick from Park Slope.
Hey, Patrick.
Hey, Doc, how you doing?
How'd the summer go for you?
Good, it went pretty good, Doc.
One of our favorite callers, Patrick.
How about you?
Oh, we had a good. Spent a lot of time in Richmond, Virginia. My daughter's doing a fellowship in mammography there. We've been. That's a dull town. If anyone's from Richmond, I'm sorry, but that's really not a great place.
Beautiful, I'm glad, Doc. I checked up on you. How long are you going to be on now? How many more months?
Oh, we're going to be on right through Thanksgiving when we have our special Thanksgiving show, and then we'll be back.
Oh, okay, good. I just wanted to say hello to you. And Doc, that was a great idea getting Kirsten on the show. You should just keep the camera on her instead of on you guys.
Patrick, thanks a lot. You're always supportive, and we'll talk to you next week.
Okay, bye, Kirsten.
Be well.
All right, on line number 2, we have Maria from Astoria.
Oh, Maria.
Yes.
How are you doing out there?
Okay.
Piccolo Venezia, huh?
Piccolo Venezia.
That's a good restaurant. Yeah.
Yes. Uh-huh.
You like that one? No?
Yes. Can I ask you something?
She didn't like I think we didn't hit it off. Maria.
Yeah, can you hear me?
Yeah, I can hear you. What do you got?
Okay. About 3 or 4 years ago, I was getting spots underneath my skin.
What were you getting beneath your skin?
Like white, red dots.
Dots beneath the skin. Where was it? What part of the body?
My hands and my face.
The hands and the face. Were they there all the time?
And now it's on my legs.
Okay, spreading rash.
No, it's underneath the skin. I went to dermatologist. They couldn't find it. I finally went to rheumatologist. All the tests come up negative, but he says it has to do with the blood.
They went to a rheumatologist. Everything came up negative.
Well, there's certainly a number of possibilities. You may have something called a leukocytoclastic vasculitis.
Whoa, 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 what is that?
Which is where there's inflammation of the blood vessels.
I never heard
and you
of
get
that one.
these little red dots.
Yeah.
I made it up. No, there are these little red blood vessels. It's not usually dangerous, but it is something which needs to be investigated. If the dermatologist isn't sure and the rheumatologist isn't sure, the next step might actually be to get a little piece of this in a biopsy and send it to a pathologist who would look at it and be able to give you a definitive
Right, I'm looking for a
diagnosis.
good rheumatologist.
Oh, you got one right there. You want to call, he's modest, but Dr. Garner, excellent.
Yeah, can I have his address and everything?
I'm going to put it up. I'll put his number up on the board, on the screen, okay?
Yes.
Okay, thanks a lot, Maria.
Thank you.
Feel better.
Dr. Garner,
Yes.
exciting news. On line number 4, Mary Alice is back, and she thinks she knows the answer.
She thinks she knows the answer.
To the quiz question.
Let's see. Hi, Mary Alice.
Hi, doctor.
How you do? How you like the show?
I love it. I love your new set.
You like the new set,
Yeah,
huh?
it's beautiful.
What do you think of our new assistant?
Oh, wonderful.
Excellent.
Very good. Very
Excellent.
excellent.
So now you think you have the answer to the question?
I think I might.
I want to hear it repeated the question so I know what you're answering. Kirsten?
Okay.
The question is, which Eastern Catholic Church is Lebanon the center of?
What do you think the answer is?
The Marionite.
Could that be the answer, Tarasia? Whoa! There's pandemonium here in the studio.
I hear it.
Wow, how did you know that answer?
I know it because I watched on the your new show Currents one night, and they had a segment about it.
That's a great show. Ed Wilkinson,
Yes.
a good friend of the
Yeah.
show, loves. He's the head of that show. What
And
do you-
that's how I know it.
yeah, that's a nice show.
Mhm.
So look,
I just need to remind her. Email us at askthedoctor@netny.net with all of your information so we can send you a prize, okay?
What if she doesn't know how to email?
No, I have email.
You know how to email?
Yes, I do.
Very good. You picked it up.
What is it? Ask the doctor. What?
Ask the doctor
Uh-huh.
at
Oh, ask the doctor.
netny.net/ask the doctor.
At what?
netny.
Oh, NET.
.net/ask the doctor.
Ask the doctor. Okay.
Okay, you have a spot picked out?
Oh, yeah. Well, I have two others.
Well, look at the 3-time winner.
Uh-huh.
Amazing, amazing. It doesn't get any less, though, right? The excitement is always there.
Oh, no, I'm going to paper my walls with them.
Good to talk to you. Thanks for
Okay.
calling in.
Okay, thanks. Bye-bye,
Boy,
doctor.
now that they sense the end of the show, everybody's calling in as the show is beginning to go.
Line number 1, we have Marie from Fort Greene.
Maybe she's looking for Dr. Casino. Let's see. Hi, Marie.
Hi.
Calling from Fort Greene.
Yes.
How are things out there?
Oh, it's fine, Dr. Gardner.
What's that restaurant, that Greek restaurant that we had in Fort Greene?
Aqualis Grill.
Aqualis Grill?
Yeah.
Is that still there?
There's quite a few. Quite
Yeah.
a few. I'm basically close to Juniors. You know, they're still hanging around.
You can't go wrong with Juniors. Beautiful.
Oh, no, not at all. I've been there 40 years.
What's your question there?
I have a question for the rheumatologist. Last Christmas, I had a stroke. I have lupus since 1985. And I had a stroke, which they did not understand. I don't fit the criteria. I don't have heart disease. I've just had a numerous amount of tests and methods. An angiogram by Dr. Saki, and there's nothing there, and the MRI show nothing. I was just wondering, could my lupus had brought that stroke on? I'm doing very well. Just left me a little off balance.
The answer is absolutely your lupus could have brought on a stroke. There's something called lupus cerebritis. It's when lupus affects the brain. It can manifest itself by a stroke. I think you need to be seen by a good rheumatologist. It sounds like you're getting excellent care over at Methodist. And a good neurologist, but you also need to be tested for something called the antiphospholipid antibody syndrome.
Oh, and
So that certainly is important. I just wanted to mention the new Barclays Center in Fort Greene, and my son goes to Brooklyn Tech High
yeah,
School.
I'm like 5 blocks away.
I have to clear something up. But thank you for the call, and we look forward to hearing from you. I think one of the callers earlier had asked, and I'm pointing, I don't know which is behind me, but here we have the Blessed Mother in the World Trade Center picture, and St. Vincent de Paul is over there. So I don't know which pictures we were looking at the time, but over my left shoulder is St. Vincent de Paul, and over my right shoulder is the Blessed Mother in the World Trade Center. So we clarified that. I guess one of our astute listeners picked that up. It's good to hear. What do you got, Kirsten?
Line 3, we got Ralph from Rockaway.
Oh, Ralph. There was a tornado out there this week. Let's hear how Ralph made out. Hey, Ralph. Ralph.
Hello, doctor.
Ralph, how'd you make out in that tornado?
Pardon?
How'd you make out in that? He maybe lost his hearing. I don't know. How'd you make out in that tornado?
So far, so good. No problem.
No problems.
I got a question for Bruce, Dr. Bruce. He treated me for, not he treated, but he diagnosed my trochanteric bursa and hip problem, which I'm being treated for with injections. But I had a question. Could that be also treated with hip arthroscopy or acupuncture?
Acupuncture can help a great deal transiently for pain. Arthroscopy is not necessary for bursitis. Bursitis usually responds to local treatment with injections, with anti-inflammatories, or with just warm soaks or
We're
ice
coming
packs.
to the end of the show. So, Ralph, you got a call back. I think you got the answer there. Great to hear from you. And now we got an email from England, from United Kingdom. I think that's England, from Stone, Staffordshire, whatever that. I'm covered in stretch marks. I have them all over my back. What do you got there? You can finish that for me.
Yep, she has them all over her back, stomach, arms, also legs. She's tried creams, gels to try to stop them, but it just seems to be getting worse. They don't fade like they should. She's had them for years, and not one is faded, and they're bright red. She doesn't know what to do, and that's Nikki.
Dr. Katsini, you got a quick answer for stretch marks?
Yeah, I think it's a very important point here is that they're not getting better, they're in fact getting worse and become red, so which means it missignifies the beginning of some endocrinology, some serious condition that is very important to diagnose. Please make sure that you'll see the endocrinologist and get those stretch marks evaluated by him.
We want to go on. There's like calls coming in plenty, but we can't do it. That's it for this show. I don't know where it went to. I want to thank Dr. Marguerite Kutziner and Dr. Bruce Garner, and of course my new assistant on air. What do we call you? Kirsten. And we hope we've been able to help you. It's good to remember that you should always be proactive about your own health. Speak to your doctors about your concerns. Go for second or even third opinions. And of course, tune into net.net/askthedoctor, and here you can read the tablet columns, you can watch past episodes, and you can also register and find out more about our live audience taping. Don't forget, Sunday, September 23rd, at 12 noon sharp, the Church of the Virgin Mary at 216 8th Avenue, Brooklyn, New York, in Park Slope. We've got to see you there. I want to thank you for all your questions tonight. And next week's topics, we said, are emergency medicine and surgery. And here we're going to talk about laparoscopic. So if you're overweight, you want to tune in. You got general surgery. I want you to stay healthy. Glad to have you back for our 17th season. Be well. And Joe, I'll see you in the tablet.